The UR Medicine Recovery Center of Excellence was first established in 2019. It was established to address the issues with the opioid crisis in Appalachia, in particular in 23 counties that are most impacted by this crisis. And so we've been asked to focus in Ohio, Kentucky, West Virginia, and also in two of our counties in southern New York, which is considered the northernmost part of Appalachia. The national average is approximately 27 deaths per 100,000 individuals, but in our 23 counties in Appalachia, the average is more like 62 or double that amount. And in some of our most impacted counties, it's 127 deaths per 100,000 individuals. These counties are greatly impacted due to, poverty levels, other determinants of health that make them more susceptible to this crisis. And they also have lack of care, lack of access to care, transportation and distance challenges and so forth that make it difficult to get their treatment as needed.
The ecosystem of recovery is a framework for establishing a system of care, and system is a really important component of that. It's not just one program. The first piece is around saving lives. An example of that might be naloxone, where we're helping patients who may not yet be ready to enter into a program be able to access treatment and save their life. The second component is around engaging the community. The third component is increasing access to treatment, and that may be lots of different levels of treatment. The fourth component is around increasing screening for mental health and substance use disorder. It's a lot of the prevention that we might be able to do up front. And finally, we need to have systems of care for patients who are in their recovery. We need to be sure that we're engaging patients around all of the social determinants of health, housing, their social supports, and everything they might need to sustain that recovery.
Casa Trinity is a substance use disorder organization, community-based organization, and we have a full continuum of care for individuals that suffer from substance use disorders. So we have outpatient program, we have intensive outpatient programs, we have residential programs, inpatient programs, and detox. Casa Trinity is collaborating with the Recovery Center of Excellence by pairing a peer with the behavioral health assessment officer in the emergency room department. Sometimes there's an individual that will go into the emergency room that needs substance use disorder care, and they're not equipped in the emergency room to help this individual. So our peer, who is an individual in sustained recovery and works for Casa Trinity, goes in and starts to discuss what possibilities that care is out there for these individuals. And they bring the individual into the level of care they need, which is not generally the emergency room department in the beginning.
One of our goals is to expand treatment in primary care offices, but that's a big change in the way that many of us were trained. We didn't traditionally learn about it in medical school and not in primary care residencies. So while we're training primary care clinicians to feel comfortable and confident in treating opioid use disorder, we needed to create a bridge. We treat patients during that bridge time, which was sometimes a gap where they would fall out of treatment. We prescribe their medications for them, and we meet with them regularly until we can train up their primary care clinicians to have patients receive their long-term treatment, just as they do for other chronic diseases, in the comfort of their primary care office.
The stigma campaign started in the fall of 2020. We did some research on what helps decrease stigma and bias. And the idea behind it is that if we could reduce stigma and bias, we could help people get into treatment more readily, engage in treatment for their substance use disorder. We have done a couple of workshops to reduce stigma by getting people to understand more about it, understand that there is effective treatment for it, and we're attempting to humanize the people who are struggling with substance use disorders by getting people to understand them and know them. Another part of our work in the coming year will be planning and implementing a conference in May of 2022, which will be titled Taking Action, National Rural Substance Use Disorder Health Equity and Stigma Summit.
Telemedicine is perfectly suited to treat patients with opioid use disorder. We very rarely do any kind of physical exam, And mainly, our treatment consists of talking. We started using telemedicine for opioid use disorder before COVID. The biggest challenge that we run into is the technology. So making sure patients understand how to get onto the format that we're using, making sure their internet is stable and strong enough to be able to have the connection. And we always try to make sure we have a backup. So if the internet isn't working, we can usually call the patients on the phone. We usually can figure out a backup.
One of the things that makes our center unique is the diligence with which we apply the rural adaptation process to make these programs most accessible in rural communities. We're additionally really happy to report that we have created 107 unique products to date. So anyone and everyone is welcome to visit our website and to put a technical assistance request in and to use our materials to their greatest benefit. And please reach out if there's anything that we can do to help you in your path to implementation.